Actually, many years I work on immunotherapy. My lab was the first lab who showed that antibody against special region of amyloid-β peptide can prevent aggregation and can dissolve already formed aggregates. This happened 20 years ago, and that time the company took the concept and tried a lot of things, and was many failed clinical trials. Now they come back to this aspect, Biogen. It's trying hardly to develop antibody that we talked about 20 years ago. But in the meantime, I move a little bit from immunotherapy, go to treat neuroinflammation. Neuroinflammation, it's also one of the main reasons of all the disease, not only Alzheimer, Parkinson, ALS, everyone. So what we found that if you inhibit the AXA of CXCR4 and this ligand, you can actually do two things. One, this AXA is responsible for homing of hematopoietic stem cells in the bone marrow. That means some kind of stem cell therapies. As you know, stem cell therapy is done where you should inject them, to take from out, to inject them to the people. Our concept showed that inhibition of the AXA between this ligand and receptor, they can remove these stem cells from the bone marrow, and they go to region like brains or blood or another region that need repair. So starting from here, we took two models of Alzheimer's disease models. One is transgenic, one is non-transgenic, and we treat them with an inhibitor called AMD 3100, and we found a very important task that we can increase the MCT1. MCT1 is monocarboxylate receptor for lactate. So this gives us input that maybe we can take AMD, we increase the transporter of lactate, and combine with lactate. Lactate is also a very stimulatory molecule, and in Alzheimer, it's a loss of this lactate and also loss of this transporter. So our combination showed that work much better than each one alone. And then we look for pathology, and so that you can reduce pathology, you can improve cognitive function of these treated mice. So shortly, we can convince the people also and publish the papers that we can use our technology instead of inject stem cells. It's some kind of new stem cells therapy. In both models that I mentioned, we used two models, we saw that treating these mice with AMD lactate, also the AMD alone, but not lactate alone, because you have not this transporter, you can improve pathology, you can reduce neuroinflammation, you can reduce TNF-alpha. TNF-alpha is actually one of the main reasons of neuroinflammation. And the AMD not only reduce the inflammation, but also it changed the aspect of microglia from the M1 to M2. M1 is neuroinflammatory, and our concept changed to anti-inflammatory. So we reduce TNF-alpha and also increase so-called anti-inflammatory cytokines. So neuroinflammatory marker is very important for our study. We also reduce tau. Tau is the second molecule involved in Alzheimer's disease, and also reduce APP, the main molecule in Alzheimer's disease. Also, we increase BDNF, some kind of synaptophysin, plasticity, and finally, we found that we can do remyelinization of this neuronal who has damage during the disease, and remyelinization enables to repair the damaged neurons. At the end of the day, we showed that we have actually improved cognitive function of both models of mice.